It seems in the past, kids were put on the antibiotics if they had anything in the body or they had a little squeaky valve, and they were put on antibiotics. They went to dental work. They were getting doses all over the FACC place. And now someone said, let's check it out a little bit more carefully. And now we don't give as much antibiotics. What conditions that could lead to a thing where you can get a terrible infection from a simple dental procedure or minor surgery that you have to give antibiotic to prevent the spread of bacteria in the bloodstream? What would be those conditions today?
This is obviously a topic right now up for discussion. In April of 2007, the American Heart Association changed its guidelines for the prevention of infective endocarditis, which is a serious infection in the heart. Just to remind people that over the last 50 years, these recommendations have changed almost a dozen times. So it's not unexpected that once again they did change. The governing body looked at the data extremely closely and found that in most cases, simple defects in the heart, people undergoing dental procedures, were not at risk for infections within the heart. So such conditions as mitral valve prolapse or small holes in the heart no longer require endocarditis prophylaxis or antibiotic treatment prior to a dental visit.
What about if they had a hip replacement or a big rod in the back because they had a curvature of the spine? Do those conditions need prophylaxis?
No, not for the minor heart conditions. The conditions that are being recommended for are specifically outlined. If your child has, or if the patient has heart disease that's going to require surgery to fix the heart defect, those children are still recommending. The patients at the highest risk, if your child has had surgery on the heart, or has had an artificial valve put in, or patch material, these are patients at the highest risk. And those patients are still being recommended to take the antibiotics. However, if you have a small leaky valve, a small hole, or small prolapse, the American Heart Association 2007 guidelines no longer recommend taking antibiotics for dental work and procedures such as this.
Is there anything like in between, a little gray, they're not 100% sure? Is there something in between from the major thing you're talking and the minor thing? Is there anything that some people are not quite sure the right answer to?
Well, I've been speaking to many of my colleagues, and these guidelines were quite drastic. And there are many patients who have been taking antibiotics for years and years for this because they were told that they're at risk for serious infection, and now they're being told it's not necessary. So in speaking to some of my colleagues, certain conditions involving, let's say, the aortic valve with leakage, people are a little more cautious about telling their patients to refrain from taking antibiotics. I wouldn't say that this is a gray area as opposed to just individual practitioner and patient coming up with what they feel comfortable with. The American Heart Association guidelines really delineated quite clearly which conditions require and which don't. So they didn't really leave much gray area in their recommendations.
But sometimes people aren't comfortable. And the way we are treating it, we're not really putting them on antibiotics for a real extended period of time. So I still think you have to sit down and discuss it with your doctor and make a decision together, because I'm sure these things could get modified if they find out that there are cases that crop up. We're like fickle people, we change our minds. They swings every 5 years, right?
Correct.
It's bad today is good tomorrow and vice versa. So we always have to take consideration. But if it is decided there is a risk factor, what would be the drug, providing there's no allergy, what would be the drug that you would tell people to go on?
The drug of choice is amoxicillin.
Because it's cheap,
it's effective, it's inexpensive.
And what would be the dosage you would recommend?
In children, it's 50 milligrams.
50, 50
milligrams per kilogram.
So a 1-year-old is about 10 kilograms.
Correct.
That's one dose.
One dose.
Okay,
so
not like for 5 days before, 3 days
and
before.
not even 1 day before. It's one dose, 1 hour prior to the procedure.
An adult, normal weight, what would be the dosage?
2 grams.
That's the maximum.
That's the maximum.
Okay, 2 grams, and that's it. One dose.
Correct.
Okay, not for 3 days before like some people are doing.
That's correct.
One single dose. But so in other words, if you have a kid allergic to penicillin, you can use clindamycin.
Correct.
There is concern.
Correct.
Because it can cause, I think, also cemental cause. But general rule, on a single dose, large, whatever the dose is comfortable with the doctor, and there's some guidelines, it's probably not going to cause trouble in a single dose. But if you had a history of colitis, using a lot of antibiotics, there is some concern. Okay, you can also use the cephalosporins, but you have to be careful in which ones you should choose.
Correct.
If there's a cross-reactability, there's some indication that the concern that we had in the past may not be as much a concern as it is today. But still, we're trying to be more selective using antibiotics for many reasons. And one is overuse.
Correct.
Okay, and inappropriate use.
One other thing, sometimes people do claim, if you have a patient who needs to take antibiotic prophylaxis and it's a strong indication, it might be worth checking to make sure with an allergist if there is a true allergy to penicillin before trying other antibiotics, because sometimes it may have just been someone
Had a virus and
in a rash, right?
and some of the allergies will tell you that sometimes allergies are permanent.
Correct.
And we don't know why. You could be very allergic to something when you're 4 years old and you're 40, you're not. Or vice versa. All your life you took a certain medicine, never had a problem, we don't know why, you wake up, you're allergic. If you can figure that out, you're smarter than me. I don't think we know the answer. Okay.